The virus emerged from the Central African rainforest as long as 50 years ago, and it traveled out of the jungle in a human host and onto a highway. Scientists call it the AIDS highway.
The first notice from the CDC hardly seemed chilling. 5 homosexual men in Los Angeles had developed a rare type of pneumonia. Scientists say this probably means they are dealing with some new, deadly, sexually transmitted disease.
Although most AIDS cases are in the United States, it's also a growing international concern. 18 countries listed almost 4,000 cases.
Today's report offers little good news. More cases than ever, half of them now in women, and expanding outbreaks in parts of Asia and Eastern Europe.
We want to have people understand about this epidemic today. It is that it is still a very dynamic, spreading, evolving epidemic, which is reaching new areas and continuing to spread. And secondly, that the worst is yet to come.
More than 5 people now die every minute from AIDS.
Doctors are sounding the alarm at the World AIDS Conference in Geneva that in many countries the epidemic is out of control. Some are now comparing it to the Black Plague of the Middle Ages.
You don't go from 20 cases to 70 million cases without realizing that nobody gives a damn.
The World Health Organization estimates HIV infection worldwide is nearing 20 million people. In 5 years, the number is expected to double to 40 million. It has cast a shadow that reaches round the world.
In sub-Saharan Africa, AIDS has cast a long shadow. 2/3 of all the world's people who have the virus live here. 2 million are children. World Vision is fighting AIDS on all its devastating fronts by training and equipping caregivers, educating pastors, mobilizing churches, promoting prevention with young people, caring for orphans and vulnerable children, and providing support for those living with HIV and AIDS. Each life broken by AIDS is another life that breaks the heart of God. But while gains have been made, AIDS is a formidable opponent. In Africa, where our work began, AIDS arrived decades ago, leaving fearsome calling cards. Sickness, death, fear, and suspicion.
My son was the first victim. I thought the disease was going to wipe out our village.
In those dark days, Pastor Joseph Sinyonga saw his church members shun and even spit on people with AIDS.
During that time, all we preached was judgment, and there was little talk of love.
Church membership dwindled. Pastor Joseph didn't know what to do. Even he was afraid to reach out.
As pastors, we were worried and scared. We were thinking day and night, what will we do with this problem? Because people were dying, and we could not help them.
In Kasangombe, Uganda, World Vision started battling AIDS at the grassroots level, looking for an effective, sustainable solution. It had to happen fast. Staff began with the power of truth, educating people about the causes of AIDS and how to prevent it.
Today we are going to learn about AIDS.
Teaching children to teach children.
And what is HIV?
Our life skills program for boys and girls emphasizes abstinence before marriage and faithfulness to spouses after marriage.
Clap for her. Very good.
We support health clinics so medical staff can teach adults about AIDS prevention and care and keep young mothers with AIDS from passing it to their newborns. Kasangombe's spirit of fear was replaced by a new feeling.
Because of the work of World Vision, people started loving each other.
Today, membership at Pastor Joseph's church has doubled.
I want to tell you, there is hope.
Hope comes to Mama Betty's house nearly every day in the form of another Betty. Betty Serenkuma. She is just one of many thousands of volunteers that churches and villages are now sending out. They are trained by World Vision to visit the sick and watch over their children. Betty's visits are all the more important because Mama Betty has grown blind due to AIDS. Just hearing the voice of her friend lifts her spirits.
I do it because I love it very much, and it's not a burden to me. And I know it's God's work, not me. World Vision taught us how to love one another. We are now starting to look after children, especially orphans and vulnerable children.
World Vision has done a lot for my daughter Angel, and it is hard to explain it all.
World Vision helped Mama Betty gain access to health care, so she did not transmit AIDS to Angel at birth. Angel is AIDS-free.
World Vision has done a lot of things for our children. They know them by name and where they live, and all of them have the same heart of caring for children. And if they were a political organization, we would have given them a second term of office.
Mama Betty is now taking government-supplied antiretroviral medicine that will prolong her life.
If I would count all the things World Vision has done for us, I would be counting from morning to sunset.
Amen.
But AIDS also casts its dark shadow across Asia. India, one of the largest and most populated countries in the world, now has nearly 2.5 million people living with HIV and AIDS. In Chennai, one of India's worst affected areas, this World Vision clinic has helped families cope with AIDS for nearly a decade through prevention, care, and advocacy.
This is the first care and support program in Chennai, started by an NGO.
And started in 1999, so World Vision was one of the first NGOs to recognize the problem of AIDS in India.
Yes.
With AIDS, the physical effects are just one part of the problem. In countries like India, the stigma of AIDS leaves many, especially women, shunned, destitute, and without a future. These are the widows in distress that James speaks of in the Bible, the ones we must look after. Maheshwari was one of these. When World Vision found Maheshwari, the mother of 5 was just skin and bones. She had been cast out of her parents' home. When a World Vision staff member touched her, Maheshwari broke down and wept. It was the first time someone had touched her knowing she had AIDS. Staff took her to a hospital and then to a World Vision home. She would watch from her bed as the women who cared for her prayed and sang hymns. The love she saw in them and the Jesus they talked about gave her a reason to live again. Today, Maheshwari is healthy and working, and so thankful.
I couldn't believe there were actually people like that who cared for somebody like me.
In India, World Vision is working alongside churches, like that of Pastor Samuel Devanesam in Chennai. He's been one of the few pastors here who's been willing to conduct funerals for people who have died from AIDS.
And when the church and the World Vision work together, we can do tremendous things.
In the late 1980s, the shadow of AIDS fell across Romania's notorious state-run orphanages. These children, abandoned as infants, were subject to unnecessary blood transfusions to treat anemia, blood tainted with HIV. These are the children who suffer, who Jesus called to him, to whom the kingdom belongs. These Romanian orphans were not only left alone, they were left with AIDS.
All the medical staff were dressed like cosmonauts. We didn't even touch the children. The children were staying like sardines in hospital beds. We had around 200-300 children HIV infected, and 2-3 of them dying every day.
Dr. Rodica Matusha watched them suffer.
I realized that being strictly a doctor is not enough. These children need more.
she made sure they got more care, and more room.
Dr. Rodica Matusha came and took me to Chernovoda in a house where there were not many children. Only 10 children. The conditions were much better there.
And she made sure they got more love.
And we didn't have nurses. We only had moms.
Bonjour. With World Vision support, Dr. Rodica gave these children more than just a house. She gave them a home.
To me, this is the greatest joy, that I lived to see that the skeletons, as I called how the children looked back in 1990, these children are grown-ups now.
In Armenia, the church is working to keep the AIDS rate low as well. Father Isa Artenian was confused and frightened by AIDS. But working with World Vision's Channels of Hope program, Father Isa came to understand the church's essential role in combating the crisis.
I think the church has a decisive role in helping people who suffer from AIDS. In Armenia as well as all over the world, there exists a huge number of organizations that fight against the illness.
This is a fight that must be won. We need to continue to battle a disease that continues to spread. A disease that now casts its long shadow far from Africa, in places like Eastern Europe, Asia, and Latin America. So much can be done, but it will take a strong partner, a partner like you. You can help. One person can make a difference by joining the thousands who have chosen to sponsor a child. Enabling World Vision to demonstrate God's love to women like Betty and Maheshwari and children like Angel. One person can help by knowing the issues and speaking up, ensuring that our political leaders never forget AIDS' most innocent victims, the children. One church can help by gathering to assemble hundreds of caregiver kits filled with supplies to equip African caregivers like Betty who are loving their neighbors as themselves, or by adopting a whole community affected by AIDS. It's not too late. This is a battle that can be won. By working together, we can turn today's news of tragedy into tomorrow's headlines of hope.
The World Health Organization reported today that new AIDS infections are declining at a dramatic rate.
From Africa.
And the American Church has united to care for the estimated 15 million children orphaned by AIDS.
To Asia, to Eastern Europe, and Latin America.
New antiretroviral drugs are keeping HIV-infected parents alive to care for their children.
We can be the light in the dark places where AIDS casts its long shadow.
New hope dawns in the fight against AIDS today, making possible the world's first AIDS-free generation in decades.